Destination Medicine is a collaborative initiative of regional training hubs. With first-hand lessons learned from those who have gone before, this podcast is designed to assist and inspire anyone interested in pursuing a medical career in rural and regional Australia. Welcome to Destination Medicine. I'm Peter Letts. Dr. Tau Loseli has had an extraordinary life journey. From farming vegetables with his family from the Pacific Islands to specialist orthopaedic surgeon based in Wagga and Griffith in New South Wales. He has a wealth of insights to offer about medicine, the importance of a balanced lifestyle, and the great benefits of working in a supportive environment in a community that you love. But first, Dr. Tau Loseli describes his early life to Nicole Goodman.
I'm the oldest of 5 children. My parents were unskilled labourers that came from the island of Tonga in the South Pacific. So that's where I was born. At the age of 4, my dad, who was a policeman back home, made the decision that life there was a bit hard, and he'd seen on a lot of the postcards that Australia was a bright, sunny place, and he thought that's probably the place where I need to get my children so that they can have a future which is easier than what he had toiling out there in the farm. So we stayed in Sydney for about 6 months, and then we moved out to Griffith, about 6 hours west of Sydney. And the reason we were there was because my grandparents had immigrated to Australia about 5 years prior to that, just to test the waters. And so they were thriving and doing a lot better than they were in Tonga. And so that's how we ended up out there. Griffith is the food bowl of New South Wales. So I spent a lot of my summers in the fields picking onions, pumpkins, watermelons, and then in the winter that would turn to things like parsnips, carrots, and swedes. And so a lot of my childhood was me being raised up in the farms, and I saw firsthand what it meant to earn $1. And so a lot of things I cherished because I knew how hard they were to come by. And I think that instilled in me a sense of appreciation and gratitude for a lot of the things that I have now. And, you know, my wife will often get angry at me because I will often wear a shirt for 3 years and I won't get rid of it until it's pretty much falling off my back. And that's just a product of the environment that I grew up in. Again, my parents knew that education was the key to break this cycle. And so they pushed us to concentrate on school. So what little money they had, we were able to do extracurricular activities such as piano lessons, tutoring, and a lot of sports, which was hard given they had to raise 5 children, but they made it work. And so I was lucky enough to be surrounded with good people, and also faith was a big thing as well. So I was raised in the church, and, you know, God was the forefront of a lot of my personal aspirations. And because I had a good moral compass on me, that kept me out of a lot of trouble. And so I was able to go ahead and finish primary school and then also all of my high school in Griffith.
Clearly, your parents prioritised education. When was it that you realised that you wanted to study medicine?
So I was influenced by an uncle of mine, William Tangi. He was a general surgeon that trained in Tonga in New Zealand, and he came to Australia to work in Griffith with his young family right around that time where I had to make a lot of decisions about what I wanted to do around sort of year 8, 9 and 10. And seeing Bill, the way he held himself and the amount of respect and gratitude people had for him, that really inspired me. And I would gravitate towards him, and he would tell me stories about his ward rounds, how the patients would be so thankful and grateful for the help that he was performing. And so based on that and my marks and enjoyment of science, I thought, yeah, medicine is going to be the career that I'm going to choose.
Describe your academic pathway to medicine and also how you found the process financially.
You know, for me, looking at medicine, it was this illustrious award that only the top 99.9% of people could reach. And for me, that was a big step. And I still aimed for that with the support that I had, but I knew that it was going to be difficult given I didn't have a lot of the access to educational programs, to a lot of extracurricular stuff that a lot of the city kids have, that they can build themselves up and become a little bit more well-rounded in terms of their application for medicine. So I didn't have any of that. And so I had a chat with my career advisor who said, yep, we're still going to aim for medicine, but plan B is going to be going ahead and doing undergrad medicine. And so what I did was I studied as hard as I could, and I got up to a 93 in my UAI. The UAI was the mark that you needed to get on into university. So it wasn't 99%, and so I wasn't able to go ahead and do medicine, but it was still a suitable mark to go ahead and get to university to undertake medical science, which was a stepping stone to postgrad medicine. And so going through university, I was able to complete my studies with the help of my family. So I was able to stay with family, and that meant that I didn't have to pay for things like accommodation. They provided food and a lot of the things that I needed. Once I finished medical science, I then applied for medicine, and I was able to go ahead and study medicine. Again, this is going to be another 4 years in addition to the undergrad medical science. And so that's 8 years of no income. And I was very fortunate to be able to tap into a resource which was a scholarship which helped kids from the country go on and study medicine. And that gave me a lot of freedom being able to study medicine and not have that worry about, what am I going to eat or where I'm going to stay. And so that was a big help for me. The other thing that I found useful was that in the University of Wollongong, a lot of their criteria and also a lot of the curriculum focused on rural medicine. And so I really enjoyed that because I was able to then come back home to Griffith during the holidays and partake in some GP practice work with one of my local doctors. And he was actually my family doctor, and he raised me coming up, as a young child. And I was able to see some really cool stuff with him and things such as autopsies, which was a dying art back then because it was something that not a lot of people done. And so that was the first time I saw an autopsy, and that was as a second-year medical student in the country with my local family doctor. So after I finished medical school, I did my internship at St. George Hospital, and this is a large hospital in Sydney, and it's a big tertiary centre. And this was where I really came into contact with the nitty-gritty of orthopaedics. And I was able to see patients from admission in the ED. I was able to work them up, see them through to theatres, again at the end of the operation and their recovery. And that's what I really enjoyed, was seeing a problem and putting my hands on it and having an instant result. That was very gratifying.
Tell us about rural placement during your course.
So rural placement was a big part of the University of Wollongong. I spent almost a year out at Lennox Head and Ballina up in northern New South Wales. This was a longitudinal placement, which was a unique feature of the course because it meant that you were living, breathing, and being part of the community for a long period of time. And so the reason I enjoyed that was it was very much had the country feel to it. So I felt right at home. I knew the GPs. We would go for a surf during our lunch breaks for an hour and then come back and see patients in the afternoon. And it was there where you got a sense of community. I would play with one of the local touch teams. We would, go around to some of the local farms and just being involved in the community. And it really just cemented to me the reason why I wanted to come back into the country, because that's where I felt useful. And the rural placements really gave me a sense of joy.
Can you expand on that a little bit? In what way did it give you joy?
So it gave me a sense of belonging, and it made me feel appreciated. So, for example, last year, coming back to work as an orthopaedic surgeon in rural New South Wales, I was able to perform a knee replacement on my Year 3 bus driver. And so that was a privilege because she was very proud of me and I was very happy to be able to help her. And as well as my Year 7 teacher, she had a broken wrist, which I helped fix. And it's a different type of reward you get. So you get the patient satisfaction from your standard patients, but there's a sense of joy because I'm giving back to my community and I'm treating people that helped influence and shape me. And that's what I mean by the sense of joy and fulfillment that I get from working in the country.
Orthopaedic surgery in particular is noteworthy for you because your interest in it was prompted by a family tragedy. Can you tell us a bit more about that?
It was. So when I was in my first year of med science, my younger brother, he came to live with us as well because he started a business degree. I was learning the basics about science, and then he had a broken arm, a proximal humerus, which is just around the shoulder joint. We had this looked into, followed up, and what had happened was that he fractured around a cancer. Now, this wasn't any type of normal cancer. It was the worst type of bone cancer that you can get, and that's called an osteosarcoma. So I just think back to that moment because my parents had to stay in Griffith to work. And so the appointments I went to see the orthopaedic surgeon who specialised in tumour, he explained things really well to us, and he had a sense of empathy. And this was the first time that I had seen real empathy. So he was putting himself into the shoes of my brother, because my brother had to have an amputation at the shoulder joint. And just the way that he worded things, I could really sense the empathy that he had. And so a lot of the post-operative care, a lot of the allied health, physiotherapy, follow-up, radiology appointments, he personally sorted himself, and he would call us and be in touch with us to let us know what was going on. And I was able to then go ahead and start my orthopaedic training, and I was able to share this story for him. Obviously, he doesn't remember this because he sees a lot of patients in the same situation, but he had a big influence on me on wanting to pursue orthopaedic surgery especially.
Amazing. Now, you grew up in Griffith. You've spent a lot of time in the country, but how and why did you end up practicing in Wagga?
So Wagga is the big city for the Griffith kids. So Wagga is where all the hard schools are, where all the sporting talent comes from. And so it was always the big smoke was here in Wagga. After I finished my intern residency, I applied for an orthopaedic unaccredited job here, and they were very supportive because I was from the area. And so Griffith is only 2 hours from Wagga, and the department here have nurtured me from my baby years as an orthopaedic trainee all the way through to them opening their arms and inviting me back as an orthopaedic surgeon. And so they've seen my story and my journey, and they've been very supportive through it. And so that's the reason why I'm here in Wagga, because this is home. This is where I first encountered orthopaedics, and this is where a lot of my colleagues and mentors are, and it's where I belong, and it's where I feel at home. And so currently I do a lot of work out in Griffith, so I'm there operating at least once or twice a month, and I'm also doing regular clinics there. And the reason I do that is because I feel obligated to help my community. So I remember growing up, a lot of my friends and family members, they would have fractures and they would need to come to Wagga at least 3 times in the 6-week period, just for simple things such as fractures that needed plasters. So that's a 4-hour round trip for an x-ray and a consult, which takes about 10 minutes. And so that was always a big deal, was access to healthcare. And so once I had finished and obtained my specialty training, that's where I felt I could be of greatest worth. Rather than being just an orthopaedic surgeon, another drop in the ocean in the city, I'll come back here, be part of my community and help give back to the people that shaped who I am.
You also studied in Sydney. What are your thoughts on working in the medical field, rural versus metro?
For me, there's not really an option. It's always been the country. And the reason is the people here are a lot friendlier. They're not in a rush to go. I don't know where they're going, but, they're much nicer. They'll say good day, and the air is fresher out here, and there's so much to do out here. And just from my firsthand experience, my feeling is that the people in the country just have a good head on them because they have different experiences. I think it's something in the water, but that's the reason why I came back, because I want my kids to grow up in the country and have a similar sort of upbringing to me, having access to seeing how primary produce is grown, where their meat comes from, where their food comes from, and just being able to get out to the wide open spaces, go camping, swimming in the river, things like that. It's something that only the country can offer, and that's why I wanted to bring my family back here to raise them.
Tell us about your current role. What are you doing?
So at the moment, I'm an orthopaedic surgeon in both here in Wagga and in Griffith. I'm part of the trauma roster here. So I see all of the fractures and treat them. And then I'm also doing elective operations, so people that have arthritis, looking to help them by doing joint replacements. I'm also doing a lot in terms of being involved with teaching, because I have a passion for that and I want to raise the next generation of country orthopaedic surgeons. So I am able to influence them at a junior level, so doing things such as teaching, being involved in registrar training. Over the weekend that just went by, I was also involved in something called the Orthopaedic Women's Association in Orthopaedics, and that's a movement to try to increase the number of women that are looking to do orthopaedic surgery. And so if they see me and I can chat to them and just share a little bit about my experience and why we need more diversity and more women in orthopaedics. So I feel as though that's where I can influence people, is at the grassroots, and any chance I get to talk about the country and my experience in orthopaedics, I take that wholeheartedly.
So far, what's been your most rewarding role and why?
For me, my most rewarding role is, I think at the moment, the surgery, the grateful patients, that's all very rewarding. But the biggest thing that I've found most satisfying is being able to spend time with my kids and my wife. So it's taken about 16 years from the start of university to the end of specialty training. And I've got 3 kids and my oldest is now 11. But now I'm able to spend time with them. Because prior to this, I was working a lot. There's a lot of exams through orthopaedic training. And so a lot of my time was actually away from them. I actually joke about it and I say that my wife raised our children as a single mother. And so she did a lot of the hard work. So for me, it's very easy to control my hours. So if I want to have a 3-day week, then I have a 3-day week. If I want to go and take a day off to go to my 5-year-old's athletics carnival or volunteer at the local school canteen, that's what I do. And so I don't have to work 7 days a week, 24 hours a day, because now I get to enjoy the fruits of my labor. And these are the plans and the visions that my parents and my grandparents had for me. And now I'm fulfilling that because I'm able to live a life that I have control of and I'm doing something that I enjoy. So spending time with my family is probably the biggest thing that I've enjoyed the most post-surgical training.
That is beautiful. What kind of person is best suited to the kind of work that you do? What qualities make the best orthopaedic surgeons?
I think the biggest thing is probably being a good problem solver. To be a good problem solver, you have to be a good communicator, you have to be empathetic, you have to have leadership skills, and you have to have technical and medical expertise as well. And I think if you can do that and you have a passion for wanting to help people and using your hands to put onto a problem, move it about, fix it, and then solve that problem, I think the orthopaedics will be for you.
Finally, Tau, what advice would you give to a medical student that's unsure perhaps of what career path to choose?
I didn't know I wanted to be an orthopaedic surgeon 100%, probably until the end of internship. So for medical students out there that aren't quite sure what they want to do, that's totally fine. And you've got lots of time to decide. But what I would advise is to have a look at the consultants and see what they're like and see how happy they are. If they seem to enjoy their work because they're involved and they're actually making a difference, then that's a happy consultant, and that's probably somebody you want to model your career path off. But obviously, if you're seeing somebody that's a bit snappy, they're a bit grumpy, and they're a bit stressed, you got to think, I wonder why that is. And then when you do those terms, you'll be able to see what the actual work involves and some of the pressures that they may encounter. And then you can make a bit of an informed decision in terms of, is that really the career path that I want for myself? So that's what I try to portray to my trainees and also to my medical students. I try to show them that orthopedic surgery is fun, and I try to reflect that based on my mannerisms and my interactions that I have with them and my colleagues.
Dr. Tau Loseli, an orthopaedic surgeon based in Wagga Wagga and Griffith, New South Wales. This is Destination Medicine. Thanks for listening. Regional training hubs are supported by funding from the Australian Government under the Rural Health Multidisciplinary Training Program.